We've had consecutive governments which are neoliberal in outlook. What does that mean? That means privatization, reduced tax for the rich, and deregulation. And I've heard nothing from Starmer or Streeting that suggests that they will reverse any of the damage that's taken place over the last 30, 40 years. Essentially, we have an NHS that's been repurposed. It's been turned into something akin to the American model, which is primarily for profit. More and more, we're going to see the outsourcing of services, the de-skilling, the dumbing down of service provision, getting less qualified and cheaper staff to replace qualified doctors and nurses. So Streeting and Starmer could have made clear that they were parting from these failed and expensive policies of the past, but they haven't done so. And unfortunately, they're going to carry on with the destruction of the NHS. Yeah, so what took place in July 2022 was yet another Health Act. The consequence of that Health Act was to break up the NHS in England into 42 separate business entities. So 42 separate bureaucracies. NHS England was crucial for that to take place. NHS England was led by Mr. Simon Stevens, who was formerly of United Health, America's biggest insurer, who came and remodeled the NHS along the American lines over his 7-year tenure at the head of the NHS. And NHS England has served its purpose. So the disbanding of NHS England is meaningless. It might sound good in terms of cutting bureaucracy, but that bureaucracy has been replicated at the more local level with these integrated care systems and integrated care boards, which are equally bureaucratic. And I wouldn't be surprised if many of the senior managers and executives who've been let go from NHS England take their severance pay and end up back within one of these integrated care systems. One big thing that people aren't aware of is GP data. GP data in England half of it was controlled by a company called Vision. Now, Vision was a UK-based company, and they've been bought out by United Health, America's biggest insurer. So United Health have control of 50%, if not more, of UK patient data, primary care data. We have other companies such as Palantir, who grew out of the American deep state. A lot of their financing came via the CIA. And some people might know that they've been crucial in setting up an open prison system in Gaza for the Israeli government, where we have mass surveillance, digital ID, facial recognition. Now, I put it to you that these are not the type of companies that we want anywhere near confidential patient data, because we don't know who they're going to sell it to and what they're going to do with that data. Physician associates are a new group of medical health professionals. They supposedly are there to relieve the pressure on the service, but in reality, they're a key part of privatization. A key element of privatization is the downskilling of the workforce. The governments have created a crisis of the workforce, and they present physicians associates as a solution. But in reality, somebody who's done medical studies for 2 years, not in a robust course, is now being proposed as a replacement for, let's say, a GP who's had 5 years at medical school and another 5 years of clinical experience before they're let loose on patients. PAs have 2 years, and this has obvious safety implications. In fact, there's more and more public concern about delayed diagnosis and preventable death. In fact, the British Medical Association have submitted a report to the Leng Review into the use of physicians associates, and they've submitted a 100-page report containing 600 cases where patients have come to harm. This is a dangerous experiment, purely driven by creating the opportunities for extracting profit out of healthcare in our country. People will be noticing difficulty in accessing services, be it through your GP. Often you won't see a GP. If you do see a doctor, it won't be the same doctor twice. So you have this fragmentation. Accessing acute hospital care in A&E, well, we still have very long waits in A&E, which are dangerous. We know that people who are destined for admission, for every 80 waiting more than 12 hours for a bed, there is one preventable death. So these problems still exist. We have millions languishing on waiting lists. So the public will notice that if they need medical care, they'll find it difficult to access, they will have to wait longer, they will be presented with less qualified staff, and ultimately their confidence will be shattered, and some, if they can afford it, will pay out of pocket, and others will think they'll be saved with private insurance, which in fact they won't be in the long run. So this campaign in Camden, Keir Starmer's constituency, is designed to knock on doors, raise public awareness about what Keir Starmer is doing, particularly to the NHS, get a petition signed, up to 15,000, I believe, is their target, and present that to Keir Starmer and request a public meeting with him, and also to make their engagement with him known publicly, whether he's receptive or not. And in the meantime, in the process, educating the public as to the real dangers of the NHS, and to erase any false hope in the Labour Party that somehow they will be a protector of the NHS, which they absolutely are not.